Today's video will explain the symptoms of a root canal infected nerve and the treatment options available to help relieve the pain and restore your dental health. What is a root canal infected nerve? First, let's break down what a root canal infected nerve is. The nerve of your tooth is located inside the pulp. It is responsible for the sensation and the full blood supply. When the pulp becomes infected, often due to deep cavities, cracks, or trauma, it can lead to an inflamed or infected nerve. This infection can cause severe pain, damage the surrounding tissue if not treated properly, leading to the need of a root canal procedure. Common symptoms of an infected nerve. So how do you know if you have a root canal infected nerve? Here are some common symptoms to watch out for. Severe tooth pain. This pain can be sharp, throbbing, consistent, and especially chewing, applying pressure, or even when lying down. Sensitivity to hot and cold. The infected nerve can cause heightened sensitivity that lingers long after the hot or cold stimulus is removed. Swelling and tenderness. Swelling may occur around the tooth or in the gum, often accompanied by tenderness when touched. Discoloration of the tooth. The infected tooth may become darker, a sign that the nerve and the pulp are damaged. Bad breath or a bad taste. The infection can cause persistent bad breath or an unpleasant taste in the mouth due to the bacteria in the pulp. If you're experiencing any of these symptoms, it's important to see a dentist as soon as possible. The treatment of an infected nerve. Once your dentist confirms that you have a root canal infected nerve, the recommended treatment is typically a root canal procedure. Here's what happens during the treatment. A diagnosis and x-ray. Your dentist will take x-rays to assess the extent of the infection and evaluate the tooth structure. Anesthesia. Local anesthesia will be administered to numb the affected areas and ensure that you are comfortable during the procedure. Removal of the infected pulp. The dentist will make a small opening in the crown of the tooth, access the pulp chamber, and remove the infected nerve and tissue. Cleaning and shaping. After the infected pulp is removed, the dentist will clean and shape the root canals to ensure that there is no bacteria remaining. Sealing the tooth. The tooth is sealed with a biocompatible material called gutta percha to prevent reinfection. Restoration. In many cases, a dental crown is placed over the treated tooth to restore its strength, appearance, and functionality. Why root canal treatment is important. Treating an affected nerve with a root canal is important because it saves the tooth and prevents the infection from spreading. Without treatment, the infection could lead to an abscess, severe pain, or even tooth loss. Root canal treatment is highly effective if removing the infection and restoring your tooth to full function, allowing you to keep your natural tooth and avoid more invasive treatments like tooth extraction. Aftercare and recovery. After root canal treatment, it's normal to experience some mild discomfort or swelling for a few days, which can be managed with an over-the-counter pain medication. Your dentist will give you aftercare instructions to help with recovering, including recommendations for oral hygiene, and when returned for a follow-up appointment, once the tooth is fully restored, it should function just like any other healthy tooth. If you're experiencing any symptoms of a root canal infected nerve or you think you might need treatment, don't wait. Schedule an appointment with your dentist as soon as possible. Root canal treatment is a safe and effective way to preserve your tooth and relieve pain. If you found this video helpful, please like, subscribe, and leave any questions or comments down below. Thanks for watching, and we look forward to helping you restore your smile here at Lema Dental Clinic.